Hello. On the continuation of our previous discussion on the classification of child psychiatric disorders, today we are here to further discuss about the management of different child psychiatric illnesses. If we see the general approach of management in child psychiatry, the area which are important for the management of child psychiatry, it include a detailed history, mental state examination, physical and systematic examination, biopsychosocial investigation, and biopsychosocial treatment. If we talk about the history, so what are the sources of information? The history can be done by interviewing the child, interviewing the parents and caregivers, and taking the information from the school and other sources. The area which are important in history include recording of the presenting problem, thereafter checking for a diagnostic criteria, then looking for the severity and risk assessment, challenging behavior if present, then the biopsychosocial trigger, developmental history, intelligence of the child, language ability of the child, academic skills, school achievement, and social skill. These are some of the areas which are important to be recorded in the child psychiatry. Examination include the mental state examination, looking for the symptoms of the relevant psychiatric diagnosis. Other than that, the important area which should be considered an examination include checking for the hearing, checking for the vision, looking for the features of syndrome, and signs of abuse and neglect should be recorded if present. Further, we move on biopsychosocial investigation. After the detailed history, detailed examination, we have to do a biopsychosocial investigation. The biopsychosocial investigation should be patient-based approach in which we do the general investigation according to the case. Other than that, we do the specific investigation. For example, if we are suspecting a syndrome, then genetic testing might be one of the options. In case of hearing difficulty, audiogram. If we suspect certain organic origin problems in the brain, in that case, we can consider CT scan, MRI, or Kaiser pleasure ring in case of Wilson disease. The specific investigation should be based on the history examination. Then we do the investigation for possible complication and comorbidities. For example, in case of Down syndrome, we have to look for the heart. So for that, we can do the echocardiogram. And in case of physical abuse, we have to do certain investigation like chest x-ray if there is suspicious of any fracture. After the biological investigation, we have to do certain psychological investigation. And psychological investigation include different rating scales, Rating scales for diagnostic entities. If we are suspecting autism spectrum disorder, we can apply DOS, Autism Diagnostic Observation Schedule interview. If we are suspecting ADHD, in that case, we can apply Connell's rating scale. Other psychometric tools which are important include the scales for intelligence, which can be Wechsler Intelligence Scale, Kaufman Assessment Battery, Stanford Binet, Raven Progressive Metric Test. And we also apply psychometric tool for social development, including the Denver Developmental Scale, to look for personal, social, language, and motor skill delay in the child. After doing the biopsychosocial investigation, we proceed further to treatment, that is biopsychosocial and multidisciplinary approach. That means involving the psychiatrist, especially the child psychiatrist, psychologist or the talk therapist, the pediatrician, and the general practitioner. The treatment should be need-based. We should address the need of the child, and then we move to biological treatment for underlying illness, biological treatment for comorbid medical and psychiatric issues, the psychosocial treatment, which are useful in different psychiatric illnesses and child, include psychoeducation of the child, family member, and the teachers, supportive counseling of the parents, behavioral treatment in which we avoid punishment and encourage reinforcement, cognitive behavioral therapy, systemic family therapy if the child problem is related to family malfunctioning, parent management training to improve the parenting skills, teacher training and intervention at school, remedial teaching and special educational support if there is an academic delay in child, other social care like social care for social activities and substitution care. Thank you.